Hello, I'm Scott Roloff with IntegerHealth. Thank you for watching. Today I'm going to tell you about IntegerHealth, and if after I'm finished you'd like to learn more, my contact information is on the last slide. IntegerHealth is a healthcare analytics company that works with employers, insurers, and health systems across their health plans, wellness programs, and workers' compensation. Our founder is Dr. Jack McCallum. Jack was a neurosurgeon for 30 years, then began founding healthcare companies. The one before us was IntegerHealth, which changed its name to Signify Health, and then CVS bought it for $8 billion. A core problem in healthcare is that it costs too much. To combat that, we have all measured many things, but we haven't measured the one thing that matters most, the patient's outcome. That is what we do. 20 to 30% of healthcare spending is wasted on poor or ineffective care. Focusing on outcomes, you can root that out while getting employees and patients better care. This presentation is for employers, but insurers and health systems can use these analytics too, both as employers themselves and in their operations. Health insurers on their members, health systems on their patients. So let's get started. Conventional analytics fall into 5 buckets. Each shows only a piece of the healthcare puzzle. First, cost benchmarking, looking backward at claims costs and trends. Second, risk forecasting, scoring populations and using that to predict future costs. Third, care guidelines, comparing what a doctor did or did not do against standard protocols, the hope being that following those protocols will lead to a good outcome. Sometimes they do, sometimes they don't. Fourth, quality checklists like HEDIS, tracking whether patients receive recommended preventive and chronic care. And fifth, for wellness programs, reporting on program participation and specific metrics, like the A1C scores in a diabetes program. These are just stand-ins, ways of assuming quality or predicting costs. None measures what ultimately matters, the patient's outcome. That is what makes IntegerHealth different. We put the healthcare puzzle together, showing you the complete picture. The actual results of the care, what worked and what didn't. We quantify healthcare outcomes by merging cost and quality into a single actionable dollar value. We answer 3 questions for every patient. Did they get better? How much did it cost? How long did it take? For you, this means seeing the whole picture, not just what you paid, but what you got in return for your healthcare dollars. We have 5 patents. No one else does what we do. Today I'm going to show you 3 outcome solutions. Each is patented. First, our claims plus absence cost solution for the employees under the health plan and workers' compensation program. And workers' comp insurers can use this solution too. Second, our claims per healthy day solution for the dependents under the health plan, as well as for health insurers evaluating their members and health systems their patients. Third, our wellness program ROI calculator that quantifies the returns on wellness programs, including on the GLP-1 weight loss drugs that many employers are grappling with now. Let me show you how this works. First, the claims plus absence cost solution. We begin by defining a good outcome as the employee being at work. We then accumulate all the costs to get the employee back to work and keep them there. This chart shows the average medical and pharmacy claims costs of 14 specialists treating back patients. This is where others stop, but where we begin. We add the average absence costs on top of the claims, how long the doctor is keeping the employee off of work. These absence costs do double duty. They're a real cost, but they're also an indication of the effectiveness of the care, because the quicker the doctor can get the employee better and back to work, the more effective the doctor was. We get the absence cost by lining up the medical claims against the HR records, and we allocate to each doctor all the costs that they are responsible for, their cost treating the patient, plus the cost of referrals to specialists and surgeons, so that we can evaluate the doctor's own performance and their referral patterns. I mentioned that workers' comp insurance companies can use this too. When they do, they won't have the employer's HR records, but would use the lost wage indemnity payments to the employees as the absence costs. When we add the absence costs, Specialist 2 goes from being second best to second worst, and Specialist 9 was doing a better job than we initially thought. Although that doctor's medical costs were a little higher than most, they were getting their employees back to work faster. But there's still one more thing we have to do. If you ask any doctor why they cost more than another doctor, they will always give you the same answer. Because my patients are sicker. And sometimes they're right. If an employee has comorbidities like diabetes or obesity, they will cost more and take longer to get better. So we have to adjust for that by assigning each employee a risk score based upon how healthy or unhealthy they are, to filter that out, so that when we're comparing the doctors, we're doing so on a level playing field. When we risk adjust the data, we see that Specialist 13 is doing a better job than we initially thought, because that doctor was taking care of more complex patients. If we re-rank the doctors, Specialist 13 would no longer be 13 out of 14, but 10 out of 14. Re-ranking the doctors, this is what we get. Specialist 1 is still the best, and Specialist 14 is still the worst. But other than Specialist 12, the order has completely changed. The green arrows show those doctors that moved up. The red arrows, those that moved down. Now you might be saying to yourself, so what? Everybody ranks doctors. And you're right. Everybody does rank doctors. But you have to ask yourself, what is everybody else looking at to rank doctors? What everybody else looks at are those conventional metrics. What did the doctor charge? Did the doctor follow standard protocols? At IntegerHealth, we are the only ones that evaluate doctors and everything else in healthcare based on their outcomes. Healthcare is not a commodity. Two doctors can follow the exact same clinical guidelines and get vastly different results because one is just better than the other. Here I've added a purple line for the group average, the 50th percentile. A shorthand way to look at something is it better than average or worse than average? If we took all the employees going to worse than average doctors, their columns are above the line, and move those employees down to the line, to the average, not to one of the better doctors on the far left, but just to the average, we would decrease their costs 36%, while getting them better care. Circling back to our three initial questions, now your employees are healthier, they're getting better and back to work faster, and they're costing less. This is what we did for the city of Fort Worth. Using these analytics, we identified the best doctors for the city to put in its workers' compensation network. A nationally published case study showed how this decreased the city's costs 23%. You can use outcome analytics tactically, operationally, and strategically. On the tactical level, looking at treatment patterns, are you getting better results sending your back patient to chiropractors or physical therapists? And as we just went over, you can identify the best providers, diagnosis by diagnosis, based on their outcomes. On the operational level, now you have to get folks to those better doctors. In the case study, we didn't have to worry about that because in Texas and 33 other states, you can direct care in workers' comp. You can tell that injured employee which doctor they have to go to. You cannot do that under a health plan, but you can still get your employees and their dependents to the best PCPs, specialists, and surgeons. Working with the case managers helping the high-cost and chronically ill employees. Going through the provider network, letting the PCPs know who the best specialists and surgeons are when making their referrals. This is particularly powerful when an employer has on-site in clinics that are the first stop for their employees. And you can integrate outcome analytics into your health plan's Find a Provider tool. On the strategic level, you can compare the plan options that you've given employees. Based on the claims costs, the high deductible plan may look great, but the outcomes might tell a different story. Because the employees are now paying their healthcare costs themselves, many may be deferring care, getting sick, and missing work. You can evaluate and compare health systems and health insurance carriers based upon the outcomes that they're delivering for your employees, and use that in your contract negotiations with them. Your data is the fuel for our analytics. It feeds our platform, which we can install on a server behind your firewall so the data never leaves you, or you can send it to us securely. We then deliver our analytics back to you in one of two ways, either through an API or data extract that can integrate into your own portal, or through our IntegerHealth TreeFrog portal, which looks like this. When analyzing the dependents under a health plan, or in the case of an insurer, their members, or a health system, their patients, we're not going to have the absence cost to match up against the claims. So we flip the question and use claims per healthy day. Instead of asking how much it cost and how long it took to get an employee better and back to work, we ask how much does it cost in claims per day to keep a person healthy. We accumulate all a patient's claims during the year for a given diagnosis, risk adjust them, and divide that by the patient's healthy days, the 365 days in the year minus the risk-adjusted unhealthy ones. Unhealthy days are days spent in the healthcare system, at the hospital, visiting the doctor, or at home but unable to function normally. Before we looked at doctors, now let's look at behavioral health conditions. If you do not have any type of behavioral health condition, it costs $10 per day to keep you healthy, because we all have some claims and unhealthy days during the year for all kinds of various things. If a person has headaches or anxiety or depression, however, that doubles to $20 per day. And if they have a drug or alcohol problem, it doubles again to $40 a day. Behavioral health is very expensive. Not only do you have to treat the behavioral health condition, but it's a comorbidity that makes everything else more expensive too. Now, wellness programs. You all have them. You know to the penny what you pay for them. Do you really know what you get in return? Now you will. We begin with the claims and absence costs for the condition that the program addresses, say diabetes. For the employees participating in the program, we take their costs in the year before they joined the program, step them up for inflation, and subtract the current year costs. That is your return, what the program saved you. Now, how much did you have to pay for that savings? From the savings, we subtract the cost of the program to get your net return and divide that by the cost to get the ROI, the program's return on investment. Usually a lot less than what the vendor promised. We publish the details on how to do this in the peer-reviewed Journal of Total Rewards. This may be one of the most interesting things we've run across. An employer had two high-volume orthopedic surgeons in its network, Surgeon A and Surgeon B. Each surgeon did neck surgeries and back surgeries. Here we're looking at the results of their neck surgeries, comparing one surgeon against the other and the group average. Surgeon A was very good at neck surgeries, and Surgeon B was very bad. So you would think by going a few vertebrae down the spine, you would find a similar result. You would be completely wrong. Now it was reversed. Surgeon A was bad, and Surgeon B was good. And this is something we often find in the data. It's not that a doctor's all good or all bad. They're good at some things, not so good at other things. And what these analytics do is they find out what they're good at and exploit it to everyone's advantage. If all this employer had done was taken the employees going to these two surgeons and flipped them around so that each surgeon only did the surgery they were good at, over a 4-year period, the employer would have saved $1.2 million. We have all heard the saying, what gets measured gets managed. In order to run your healthcare like a business, you have to quantify outcomes so you can measure the results and hold your payers, providers, and vendors accountable. Bottom line, outcome analytics will empower you to drive down your costs while getting your employees, members, and patients better care. If you would like to talk more about how outcome analytics could empower you, please contact me.